Difference between sub-Q and intramuscular injections of testosterone therapy. Sub-Q injections are administered into the fatty tissue just below the skin. They are typically less painful than intramuscular IM injections and are easier to self-administer. Sub-Q injections of testosterone are also associated with more stable testosterone levels throughout the week. Intramuscular IM injections are administered into the muscle. They are typically more painful than sub-Q injections and can be more difficult to self-administer. IM injections of testosterone are also associated with more fluctuating testosterone levels throughout the week. Which is better? The best type of testosterone injection for you will depend on your individual needs and preferences. If you are looking for an injection that is less painful and easier to self-administer, then sub-Q injections may be best. If you are looking for an injection that provides more consistent testosterone levels throughout the week, then sub-Q injections may also be a better option for you. However, if you need a higher dose of testosterone, then IM injections may be a better option for you. IM injections can deliver a larger dose of testosterone into the body than sub-Q injections. 3 times a week sub-Q therapy of testosterone versus weekly testosterone therapy. 3 times a week sub-Q therapy of testosterone and weekly testosterone IM therapy are 2 different approaches to testosterone replacement therapy. 3 times a week sub-Q TRT involves injecting testosterone under the skin 3 times per week. This approach results in more stable testosterone levels throughout the week. More stable testosterone levels can help to improve symptoms such as fatigue, decreased libido, and erectile dysfunction. Weekly testosterone therapy involves injecting testosterone into the muscle once per week. This approach can lead to more fluctuating testosterone levels throughout the week. When should serum levels of testosterone be tested? Testosterone levels should be checked at different times depending on the type of testosterone injection you are using. If you are using short-acting testosterone injections, such as testosterone cypionate or testosterone enanthate, your testosterone levels should be checked 24 to 48 hours after your injection. This is when your testosterone levels will be at their peak. If you are using long-acting testosterone injections, such as testosterone undecanoate, Nebido or Reandron, your testosterone levels should be checked 6 to 8 weeks after your injection. This is when your testosterone levels will have reached a plateau. If you are new to TRT, your testosterone levels should be checked more frequently, such as every 4 to 6 weeks. This is to ensure that your testosterone levels are within the desired range and that you are not experiencing any side effects. Once your testosterone levels have stabilized, you may be able to check your testosterone levels less frequently, such as every 3 to 6 months. When should HCG or human chorionic gonadotropin be instituted in TRT therapy? HCG is a hormone that is used in TRT to stimulate the production of testosterone in the testicles. HCG mimics LH, luteinizing hormone, by binding to the LH receptor and activating the same signaling pathways. This stimulates the production of testosterone in the Leydig cells of the testicles. HCG is also more potent than LH at stimulating testosterone production. HCG binds to the LH receptor with higher affinity than LH. HCG and LH are both glycoproteins, but they have slightly different structures. HCG has an additional beta subunit, which gives it a longer half-life than LH. This means that HCG stays in the bloodstream longer than LH, which can result in more sustained stimulation of testosterone production. HCG is typically used in conjunction with testosterone injections to help maintain testicular size and function, and to improve fertility. There are a few different ways to institute HCG into a TRT protocol. One common approach is to inject HCG sub-Q 2 to 3 times per week, at a dose of 250 to 500 IU per injection. Another approach is to inject HCG once per week, at a dose of 500 to 1000 IU. The best way to institute HCG into a TRT protocol will depend on your individual needs and goals. HCG can suppress the production of LH, luteinizing hormone, and FSH, follicle-stimulating hormone, from the pituitary gland. It is important to monitor your testosterone levels closely when using HCG. HCG can cause testicular enlargement and discomfort. HCG can interact with certain medications. Overall, HCG is safe and effective treatment that can be used in conjunction with TRT to improve testosterone levels, fertility, and testicular health.